And your surname? Okay. And have you had any major illnesses in the last 6 months? Okay. And are you currently allergic to anything? Okay. And so you're not allergic to latex? Okay, that's good. So otherwise very healthy. Okay. So we're going to be doing a medical exam today, and I am going to be taking a little bit longer on each test and doing a few more tests that we haven't done before, just to make sure I'm covering everything, as I haven't seen you for a while. Is that okay? Alright, do you have any questions for me? Okay, alright, well I'm going to start by checking your airways and your lungs. Okay. Alright, so if you could just move your shirt for me. Thank you. Alright, so I'd like you to take a nice deep breath in and release, and really try and empty your lungs as much as possible. So that's great. Alright, I'm just going to have a listen at your back. So again, a nice deep breath in and out. And again, deep breath in and out. Alright, I'm just gonna have another listen at the front, sorry. So a nice deep breath in and out. Okay, so lungs sound nice and healthy, airways sound clear. Okay. Alright, so next I'm going to be checking your blood pressure. Just getting some of this air out from the previous patient. Okay, so which arm are we going to do? This one? Okay, so if you could just pop your sleeve up for me and then just hold your arm out. Thank you. Okay. Doing great. Might be a little bit tight, but it won't be for long. Okay, if you could just hold that there for me. Won't be a moment. Okay. And that's great, thank you. Okay, so the blood pressure is perfectly fine. Okay. I'm just going to have a listen to your heart now. So again, I feel a little bit cold. Won't be on for as long as before though. Okay, so on your heart, just listening to how strong the beat is, and if the rhythm is continuous, any palpitations or feelings of irregular beats. Okay. Okay. It sounds healthy, alright, and along with the blood pressure, that sounds fine. Okay. Now, I saw from your notes that you, and I know you mentioned it before, but you have a wound just under the hairline. Yeah, I can see that. And when did that happen? Okay. Alright. Are you happy for me to change the dressing on that? Yeah, okay. What I'm going to do is I'm just going to need to cut some of the hair around that area because it does look like it's irritating the wound slightly. Yeah, okay. Alright, give me a moment. I'm going to go and get a fresh dressing and some scissors to cut that. Okay, I have my medical first aid kit, and this has various different types of dressings that I can use on there. So just looking, I can see that it's more of a padded plaster on there at the moment, isn't it? Okay, it doesn't look like you need a bandage. It looks like you just need a plaster. Okay, let's have a look. Okay, so I have a sanitizing tissue and a plaster. Alright, so let's have a look at this hair then that needs removing. Don't worry, I'm not cutting that much off, it's just kind of going around the wound. It does look like the hair is catching slightly under the adhesive on the plaster, so I think until this is completely healed I would just keep this trimmed. I'll just take a little bit off that side so it's a bit more even. Okay. Don't worry, it sounds like I'm taking off a lot. I promise I'm not. Okay. Alright, just cleaning around that. Just holding the head. Alright, just taking this old one off. Okay, it's healed actually quite a lot, so I'm just going to clean around here. Okay. How does that feel? Okay. Alright, great. So as part of our test today, I'm going to be just going briefly through your cranial nerves. Okay. So we're starting off with the olfactory nerve. Now this one is about your smell, okay, and how your nose transfers the messages to the brain on what you can smell. So alright, so I'm just going to place this under your nose. Okay, and I'd like you to just tell me what the smell is. Okay, nice deep breath in. Okay, another go. Deep breath in. Yeah, that's peppermint. Well done. And then a different type of smell, it's a clue. Just trying to get enough of the oil on the pipette. And deep breath in. What's that smell? Orange. Well done. Okay, perfect. Okay, so we're going to be looking at your optic nerve now. Okay, so just looking at the eye chart behind me, I'd like you to just read through what you can see. Okay, so you may want to turn your head just like that. Okay, let's start. Okay. Good. 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 Mm-hmm. Yep. Yep. Perfect. Yep. Yep. Mm-hmm. Yeah. Keep going if you can. Okay. Yep. Good. 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 Well done. Keep going. Keep going. Good. 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 I am satisfied that your vision is good. Just rearrange you there. Okay. So I'm going to ask you to now tell me what numbers my fingers are. Okay, so how many fingers am I holding up? Probably an easier way to explain it. Okay, so. Okay. 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 Alright, and please tell me what numbers my right hand is holding up. Good. And my left hand. Good. And my right hand. Good. And my left hand. And my left hand again. Okay. So just looking at the eye chart again, if you could just tell me what these two colours are. And here. Perfect. Yeah. That's red and green. Well done. Okay. If you could just tell me the difference between these two colours. So what colour is this? Good, green. And this? Good. Perfect. Alright, now still testing your vision. I'd like you to just tell me when the light is on and when the light is off. Okay, so just say on or off. Good. 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 Okay, perfect. Alright, now moving on to the oculomotor, trochlear and abducens nerves. All of the nerves do intertwine, okay? So the following tests will help me understand the function of those three nerves, okay? So just looking at the light for me, and then you're just going to follow this, okay? And follow this. And following again. Keep following the light. Well done. Keep going. You're doing great. Nice and slow, just following the light. So you'll notice I'm doing horizontal tests, and then I'm doing vertical tests. There's different muscles, different nerves involved. Okay, and keep following the light. I'm just going to do some different movements like this. Okay. Well done. And then okay, and now looking at my nose, please. I'm going to be looking at your pupil retraction as the light enters your vision. So looking at my nose. Great, thank you. And that's great. Looking at my nose, I'm just trying on this side. And just seeing how it responds. Okay, and now I'm just going to have a look. So if you could look down. And look up. And look down. And look up. so without the light now, please just focus on my finger here and then just follow that through. Just keep following my finger, and I'm just having a look at how your muscles are responding. Just like that. Well done. Wonderful. Okay. And then just finally I'm going to just measure your pupils at resting with no light. Just look at my nose if you don't know where to look. Thank you. Okay. All right. So now we are looking at the trigeminal nerve and considering sensation. So I've just got these. Just say whether you can feel it. Yep. 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 Good. Good. And I'm trying different parts of the face because different parts of the nerve focus on different parts of the face. So down here, the chin, here's a different space to around the eyes. Some people that experience damage to this nerve can have pain around their eyes, pain around the bottom of their face, pain on the sides. So, are you experiencing any pain? No, well, that's good news. So, just making sure you can feel everything. Good. 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 And then I'm going to use a pencil now, and I'd just like you to say sharp or soft. So, good. Yep. 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 Good. 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 Okay, and then for your facial nerve, I'd like you to just copy the facial expressions that I'm doing. Okay, so. Okay. Okay, I'm just going to turn your head this way, and if you could just do the same, I'm just going to examine the side of your face. So if you could do this. That's great, and I'm just going to direct your head this way, and now if you could just do the same. Okay, I'm just looking to see if there is any slumping on one side of the face at all. Okay, but there isn't. Alright, so now we're going to be looking at the vestibular cochlear nerve, and this one is in regards to your hearing and your balance. So I'm going to ask you to just put your right finger on your nose and then stand on your left leg, and then left finger on your nose, standing on your right leg. Okay, that's brilliant. And now just making some sounds in the ears. Just tell me if you are unable to hear the noise. Okay. Okay, I'm going to now tell you a word and I'd like you to just repeat it back. Sleep. Good. Relaxing. Sleep. Okay, yeah, no, it's the same word, I was just testing. Let's think of another one. Tingly. Okay. And last one. Pineapple. Brilliant. Okay, that's great. Alright, the glossopharyngeal nerve is the nerve in regards to your throat, so please, if you could just swallow. And that's brilliant. Alright, now the vagus nerve runs, it's the longest nerve in the body and it runs from the back of the throat all the way down to the stomach. Okay, so there's a couple of different tests for this. Initially I'm going to just have a look at the blood vessels on your legs, if that's alright. So just lifting up your trousers. Okay, and the other leg. Just get my light. Okay, that's great. Just making sure you are fully conscious. Do you faint at all? Any blackouts? Okay, and right now, how does your heart feel? Good, no irregular beating. Okay, and then I'd just like you to just gather some saliva in your mouth and then just swallow again. Perfect, thank you. Alright, now just finally, if you could open your mouth, I'm just going to touch this at the back of the throat to test your gag reflex. Okay, so if you could just open your mouth, and this goes in, and there we go, brilliant, thank you. Alright, now the accessory nerve. I'm going to need to touch your skin, so I'm just going to pop my gloves on, just to be extra careful. The accessory nerve is around your neck and shoulder movement, so I'm just going to have a feel on the shoulders and the neck. Okay, now if you could just push back against my hands. Okay. And then I'm going to push down, push back again. Okay, and turning the head this way. Great, and then turning the head this way. That's great. Okay, and then just lifting the head back. If you could just lift, there we go. And then lifting the head down. Perfect. That's brilliant. Okay, so we're just going to go finally to the so we're just going to go finally to the hypoglossal nerve, and I'm going to just ask you to open your mouth, and I'm just going to ask you to move your tongue up to the roof of your mouth, to the left cheek, right cheek, and down. Okay, great. You've got good control of the tongue. No concerns there. Alright, so that concludes the cranial nerve aspect. Alright, now I'm just going to refocus on the eyes. Okay, I'm just going to make sure that the eyes are working. I'm just going to use this light. The eyes are working nice and well. Okay, and we've got good whites of the eyes, good colour in the tear ducts and under the lids. Looking at my nose. And then looking at my finger. And then back at my nose. And then at my finger. And then at my nose. And then at my finger. And then back at my nose. And then at my finger. Okay. Alright, now I'm going to get you to follow this light, okay? I'm going to present a distraction and I'm just going to see how well you continue to follow this light, okay? And then looking at the pen, and then looking at the stick, at the pen, at the stick, at the pen, at the stick, at the stick, and then at the pen, and then at the stick. Okay. Alright, if you could just look at the pink pen and then at the pencil and then looking at the pencil and then at the stick and then the pencil and then the light and then the stick and then the light. So just using the pencil, I'm going to just test your peripheral to make sure that's all good, there's no black spots. So just keep looking straight ahead and then tell me when you can no longer see the pencil. Okay. Good. 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 Wonderful, thank you. Now, just finally, well, not finally, but to conclude the eyes and ears exam, I'm going to just have a final look inside the ears. Okay, I know we've done a hearing test, but I want to make sure actually that the ears are clean and are not filled with earwax. So just using my torch, just having a look. Okay, looks okay. Let's just compare it with this side. So I'm just having a look. It's good distribution of earwax. It's not too much of a build up. I am very happy with that. Maybe a slight bit. Okay, just the slight bit of earwax. Okay. And then on this side, I'm just going to remove the slight bit of earwax here. Okay, that's good. I'm just going to put a couple of drops of olive oil in the ears because when you get home it will flush out the rest of the earwax, but it still leaves a healthy amount inside. Okay. That's great. Now, have you had any skin complaints recently? Any eczema, rashes? Okay. Alright, let's have a look then. So, just scanning the face for any signs of acne or dry skin. Close your eyes. Okay, just looking down at the T-zone. At the chin. Chin is usually the spot where your hormones can have an impact on your skin. Okay, so this is area here. Do you do any facial grooming, so any hair removal? Okay, because it can cause spotting above the eyebrows. Okay, what's your skin care routine? Okay. Just testing the dry spots to see whether any skin is removed when I do this, but the skin does look nice and moist and healthy. Okay. I'm just using this to scrape the surface. Okay, now just using these to scrape the surface. Okay, I'm just going to use some of this oil to correct some of the dry spots that we have on your face. this mole? Have you had that mole for very long? Yeah, and has it changed in size or texture or colour? A little bit. Okay, I'm just going to measure that. Okay. Okay, I'm going to refer that mole, alright, just because I'm not a mole specialist. It does look slightly concerning to me, okay, so I'm going to refer that on. I'm just going to make a note of that. Okay, please don't worry about it for now, alright, but I will have someone else look at that just to make sure. Okay, alright, the rest of the face looks good. Just corrected some of those dry spots. Let's have a look at the neck. Just feeling for any lumps and bumps. Down the arms. Any lumps and bumps on the chest. I'm just going to lift up your top, check your abdomen. Alright, just going to lift up your trouser legs and just look at your calf muscles around your ankles. Just feeling over your trousers and on this side down. Okay, I'm just using the light. Just going to check the skin now. I'm just going to do a scan of the neck. Just going to do this up and down motion just to make sure I'm not missing anywhere. Let's try this arm. Okay, just keep nice and still for me. Okay, and then this arm. Alright, chest area, tummy, and then a brief scan again of the legs. Could you just move your right foot forwards just a little bit? That's great. I can see you do have a few freckles on the legs. Yeah, okay, just need to make sure you're wearing factor 50 sunscreen every day, okay, even if it's not sunny. Yeah, and then maybe want to consider taking a vitamin D supplement. Okay, alright, so I am very happy with how the test has gone. Okay, no concerns from me on your nerves, your eyes, ears, skin, over the body, your movements. So I am confident. Alright, apart from this mole, I'm very happy with the outcome. Okay, I'll send you a write-up of the notes, but otherwise, take care, look after yourself, and we'll have a chat soon, alright, about